Today we're going to talk about Botox. Botox is a purified neurotoxin which blocks the nerve signals that cause your facial muscles to contract. These repeated muscle contractions give rise to some of the facial lines and wrinkles that can become deeper as you age and sometimes make you age prematurely. Your appearance is described by your family and friends as being tired or angry. In general, Botox is the most often used on the forehead, the frown lines between your eyebrows, and the so-called crow's feet on the sides of your eyes. When Botox is injected into small muscles, it causes the facial muscles to become paralyzed. As a result of this, the muscles relax and the wrinkles disappear. The result of injection of Botox is to visibly soften deep lines and also prevent new lines from forming. The question is often asked as to how many units of Botox would I need. The amount of Botox that you need mainly depends on the size and the strength of your muscles. Most slender women have smaller muscles and therefore will require fewer units of Botox, as opposed to strongly built men who have larger muscles and will require larger amounts of Botox to achieve the same objective. On the average, it takes about 20 units of Botox for the forehead, about 20 units of Botox for the glabellar area or the so-called 11s between your eyebrows, and about 10 units on each side of your eye to get rid of the so-called crow's feet which result from smiling. The next question is, how long does the effect of Botox last? For most patients, the anti-aging effect of Botox lasts from 3 to 4 months. With repeated injections, the intervals between the injections may become lengthier because the muscles stay suppressed. How safe are the injections? Botox has been approved in the United States since 2002 as cosmetic treatment to correct the visible signs of stress and aging of the face. Millions and millions of people all over the world receive this treatment every single day with no serious side effects ever reported from use of Botox on the face. Even if you have temporary side effects such as dropping of one eyebrow or temporary paralysis of an eyelid, it is exceedingly rare and self-limiting. In other words, it disappears in a few days or a few weeks. What are the injections like? We use the tiniest of needles and we use a separate syringe for each injection site, which provides us with factory fresh, sharp needles to give you the injection with the least amount of pain. If you happen to be scared of needles, we can numb the area by application of local anesthetic to the forehead or the other parts of your face, wherever you want these injections to be done. And the other advice that I would give you is take 2 Tylenols about an hour before you come into the office, which will cut the discomfort into half anyways. Botox can also be used on the upper lip to improve the lines which are produced due to smoking, or sometimes chronic use of straws to drink soft drinks out of a can or a bottle. Another use of the Botox is the lines on the neck, which can be improved with the use of Botox by paralyzing the platysma muscle in the neck. If you have a problem with excessive sweating, say in your armpits or your hands, Botox can also be utilized there to effectively treat this problem for as long as 6 months. Here are some of the before and after pictures. With the use of Botox on the forehead, the glabellar area between your eyebrows, and on the sides of your eyes, the so-called crow's feet. Please feel free to call my office at 407-465-1993 for a free consultation, or go to our website buenavistaesthetics.com. We look forward to seeing you in the future. Have a good day, and thanks for watching.